Hi, good morning. Dr. Garima here, and we are discussing another of scenario-based questions for Australian Dental Council exam, part one written. This is an interesting question. It deals with amalgam, and no matter how far we have progressed in dentistry all around the world, apparently the Australian Dental Council still considers amalgam as very, very important, and that is why it will keep on asking you questions about that. And you also have an amalgam task in your ADC part 2. Trust me, this amalgam gave me nightmares in the start when I had started practicing it because I was so out of touch. And the worst part was in the ADC part 2 exam, the amalgam that they give is so fast setting that you barely have time, from mixing it, coming back to your chair, opening it, taking that ball, putting it inside, condensing it. By the time you are condensing and just about to reach the level of carving, the amalgam is set. So I had to like redo my amalgam, and it's horrible because you can't let any what do you say, scraps of amalgam falling down in the mannequin because you have to clean that also, and cleaning that is another task. So yeah, so eventually I practiced almost like 100 plus amalgam. Finally got the technique of how to do it like really quick and fast. Because in the mandibular molars, it's a lot easier. But then they give the maxillary molar, and of course, it's not a class one cavity. It's a big, huge class two with the cusp missing. So we are supposed to make that cusp also and do the proper carving. And yeah, when you'll come to part two, you'll realize it is doable. Eventually, you will learn. But yeah, in the start, it did give me nightmares. So yeah, so amalgam becomes very important. Not only putting the amalgam, but how to remove it. I mean, they are specific protocols of how to remove amalgam. You're supposed to know that. And yeah, amalgam is a part of your life if you are clearing this exam. So, anyways, let's just start. A 40-year-old patient presented at your clinic complaining of a dislodged amalgam restoration. She had this filling done 3 weeks ago in another clinic. Now, this word, 3 weeks, is very important. Keyword, I'll tell you why. I just remember it. The filling fell off 2 weeks ago. So 3 weeks ago she has done it, and the filling fell off 2 weeks ago, meaning the filling was in the mouth for just a week. And now it shows intermittent sensitivity to hot and cold stimuli. The tooth is not tended to percussion. Again, a very important keyword. Note it down. It is not tended to percussion. What does that mean? And I've told you this multiple times in the video. Go ahead, write the answer in the comments. What does it mean when it's not tended to percussion? It means that there is no periapical infection. She suffers from she suffers from anxiety attacks and takes alprazolam 1 milligram as needed. Okay, so she has anxiety attacks. For what reason, we don't know. But dental procedures are also anxiety provoking. So, in such patients, you are supposed to be as gentle as possible and listen to what triggers their panic attacks. Now, yesterday, one of the other candidates also asked me a question that can a dentist prescribe anti anxiety medications? No, you cannot. Nowhere in the world you can. No. You have to refer the patient to the general practitioner. So you cannot prescribe. So she's taking, so all you can make sure that she's had her medication before she comes to you. Now the keywords here are done 3 weeks ago. The filling fell off in 2 weeks only. That means either the filling wasn't of a good material, or the cavity wasn't prepared properly, or it's an unretentive cavity, or the tooth has fractured. But then there should be pain, but there is not. But there is hot and cold stimuli pain, which means the pulp is still vital because automatically the pulp testing has been done. Speaking of pulp testing, yesterday only I shot a very good video. I hope you all have seen it and your concepts are clear now. And the tooth is not tended to percussion, meaning the periapical status is good. So basically, a filling has just fallen off and there is a sensitivity. Now, let's see the questions. Oh, I will not give you the answers like that. Let's go back to the questions. Uh, What could be the reason of the amalgam filling to fall down? I already gave out the answer, didn't I? It's unretentive cavity. But let's see the other options in case you are not sure. Secondary caries. Now you remember I told you remember this keyword 3 weeks. In 3 weeks' time, since the time the filling was done, it's too soon for caries to start. Any carious lesion to start takes at least a month or so, and there has to be a lot of bad diet and bad oral hygiene that needs to happen, but nothing of that sort is mentioned. So within 3 weeks, it's very difficult for a secondary caries to start and progress to such a level that it discloses a filling. So that is not my answer of choice. Fractured cusp could have been right, but we saw the picture and nothing in the question scenario mentions that there is a fractured cusp. Then we have restoration material selection. Amalgam by default has been used for so many years and you cannot question its selection. It's a good material, no doubts, if done properly. But what can be detrimental for its falling off is an unretentive cavity. If a cavity is like this, which is like such a huge one, then a restoration probably will not stay and will tend to fracture and break down under the occlusal forces because here you see barely 30% of the tooth structure is left. Occlusally, there is a wall missing and it's such a huge cavity that it's very difficult for a filling to stay. So either an onlay should be done or a crown should be done. You understand? So what is the probable diagnosis? Now very important. What have we learned so far? And when we say diagnosis, we are talking about pulp, right? Pulp and the periapical tissue. An ideal diagnosis must always include a periapical tissue diagnosis as well. Reversible pulpitis sounds good to me because there is sensitivity on hot and cold, and there is no TOP positive. Open dental tubules. To an extent, yes, but you never classify a pulpal diagnosis as open dental tubules, right? You will always say with regards to pulp. Irreversible pulpitis without involvement of periapical area. First of all, there is no irreversible pulpitis because there is no spontaneous pain, there is no last long lingering pain, there is no pain at night. So I will not go with irreversible pulpitis. D option is irreversible pulpitis with involvement of periapical infection. Now, this is an absolutely wrong option because, first of all, there is no involvement of periapical because percussion is negative, and irreversible pulpitis, again, the history is not given like that. So, the only option that remains with me is reversible pulpitis, and that too, I would like to add the term transient reversible pulpitis. So, yeah, reversible pulpitis becomes the answer of choice. Now, you mentioned to the patient that for such a case, the best survival rate of a filling can be expected with. See, whenever the question is asked like this, the best survival rate, best, again the keyword, that means all the options that would be given would be correct. You have to choose the best option amongst them. So it's like asking you who's your best friend, and I will give you 5 options of all your friends. So yes, are the options your friends? Yes. Now who's your best friend that you only would know, right? So yeah, 1 second, a call is coming. Yeah, so a call had come whether I want credit cards or not. No, I don't want them. That's a topic of another discussion, and all of you all should be educated about credit cards and debit cards. It is so strange when I'd come to Dubai. Not strange actually. I was financially not educated by that time. Uh, as in my family, nobody spoke about it, especially in front of girls. That what they'll do, they are just supposed to do the household work. But yeah, here I am. So, anyways, I learned a lot about credit cards and debit cards, and wow, I'm to a level where I'm teaching my siblings now, and I think that's a financial education which everybody should have, especially the doctors, because we know how to make money, but it's so difficult to manage because we are so financially illiterate. Recently, my article was published here in the national news, where I had given my tips on how I manage my finances and budgets, being a doctor. So, yeah, anyways, whatever. Let's go back here. So you mentioned to the patient that for such a case, the best survival rate of filling can be expected with. Yeah, so I was just telling you all that all the options that would be given would be correct. You have to choose the best one. Now let's see what are the options. Full veneer crown, decent option. Amalgam with minimum 3 pins. Now speaking of pins, and back to minimum 3 pins they have mentioned. It's not like 1 pin. Yeah, I've opened this thing for you all. Yeah. See, this is a pin, okay? This is a drill, and here the pin is going to be placed. Have you all ever done amalgam pins? Honestly, I've done many amalgams in my internship and in this ADC exam, but never ever I have either seen an amalgam pin or done one. Okay, but what I do know is when you have to put that pin, it's of three types: the friction lock, the threaded, or the cemented ones. Cemented ones are usually done in root canal treated teeth. It's the friction locked or the threaded ones which are done in a vital tooth. Now, what happens is you're going to like drill the tooth or you're going to screw motion, you're going to force the pin inside. So, when that happens, there are chances of dentinal micro cracks, lowered fractured resistance, meaning the tooth can fracture very easily, and reduced transverse and tensile strength of amalgam. So, basically, it's just giving a little bit of support like a post and core, but not inside the canal. It's outside, it's just in the dentine, and you are putting something just to give a stability to the restoration above it. Now, if already there is an unretentive cavity, why would you want to further weaken the tooth structure? I mean, it used to be done before because amalgam was the only material that was strong enough to stay. But now we have such good materials and crowns that this is like the disadvantage is way more than the benefits of amalgam with the pins. So coming back to this question, amalgam with minimum 3 pins would only cause more fracture to the tooth. So I'm not going to choose this option. Composite build-up, great idea. It's such a huge composite. Glass anomer core and crown. Now you see the option A and option D. They both have crowns. But option D is a little more specific. You're giving a core and then you're making a crown, which makes more sense. Post core and crown. Now, many candidates in this question had marked option E and they were asking me why Dr. Post core and crown is not the right option. My dearest, where are you going to put the post? In a vital pulp? No, right? You will be doing root canal, then putting the post and then core and crown. But why do you want to do root canal? The pulp is really healthy, correct? So don't jump onto post core and crown, which seems like a very tempting option. But it's a very invasive option, and you'll have to do a root canal, and you don't want to do a root canal. The tooth is nice. So the best option of choice is D, glass anomer core and crown. Understood? When the patient knows the treatment cost, she told you that she saw online an advertisement of another clinic which offers 2 crowns for the price of one. What do you think about that from a professional point of view? There'll be at least 5 to 6 professional ethical questions that would be asked in your exam, and you must not make a mistake in that because they'll be surely marked questions. Apart from one or two which may be unmarked, but mostly they'll be marked questions, and they'll be a very important questions from the marked perspective also because you should not be making in these kind of questions because having professional ethics is very important. So, for example, in paper one, you have three professional questions and you have the rest of them, the other dental questions. What I've understood is example. There are 70 questions and there are three professional questions and 67 the rest of the dental questions, and you mark the 67 right and you mark only these three wrong, the professional questions. Chances are you will be flunked. You'll not get the proper grade. Why? Because the professional questions are very important and giving a right answer to them is it's like ethics, you can't make a mistake in ethics. So make sure that you get the ethical questions right even if you are marking one or two of the dental questions wrong. Understood this point? So anyways, you like this idea and decided to do so as long as it does not conflict with professionalism. You will not do so as it is non-professional behavior. You have to submit an application to AFRA before such advertisement. What is AFRA? It's the Australian government body which determines the medical legal cases, and what should be done and what should not be done according to the guidelines for Australia. You have to submit an application to ADA before such advertisement. First of all, as dentist, you're not supposed to advertise. It's against the ADA guidelines. You cannot like this idea. It's wrong. The correct answer here is you will not do so as it is a non-professional behavior. So you cannot advertise. So option C and D are out of the window. You cannot like this idea either because this is not professional. You will go with option B. Understood? Weekend cusps require capping. What should be done to cap a cusp? The first rule of making a crown on cusp is always to remove 2 mm of the cusp with outline of the cusp. You're not going to make it flat. You'll maintain the contours. You all have done crown cuttings. You all know that you never make the cusps flat. It's always following the contour of it. So I don't even have to look at the other options. I can directly go with this option. But anyways, let's just see. Minimum 2 mm of amalgam is required. Okay. Cusp should be reduced to level of gingiva and then build up. Ooh, no. Add a pen for each cusp. No. Reduce 2 mm following the outline of the cusp. Yes, reduce 2 mm of the cusp with flat outline now. So option D becomes the right answer. So yeah, this is how exactly questions would be asked in your ADC exam. Of course, they can change the scenario. So they can change some keywords, they can change some timelines, and you'll have to choose from the same options, but a different answer might be the right answer. So that's why I always read the question properly, read the keyword properly. Don't beat yourself up if you have solved 5, 6 marks and your score is low because your brain is not conditioned to uh, think the ADA way, but you will eventually learn it. So it's a lot of practice. My suggestion for passing this exam is solve as many mocks as possible and revise it as many times as possible and study therapeutic guidelines and infection control. In the description below, I have given the links of the books where you can find it. So go through that and thank you.